All right, so the topic that I'm going to cover this evening is non-alcoholic fatty liver disease, NALFD or NAFLD, and NASH, non-alcoholic steatohepatitis. Those are long terms. Basically all it means is fatty liver, and fatty liver that's gone to the place that you've got an inflamed liver. So this is the foie gras of humankind. What's foie gras? That's where they feed ducks or geese until they stick a tube down them and just force feed them so that their liver gets really fatty, and then it's supposed to be a delicacy. I haven't tried it. I'm not really tempted. You won't be after you tonight either. But so this is a problem that is epidemic in our country. More people have liver disease from this than anything else. In fact, than all other causes in the country today. 70 to 100 million people in the United States have fatty liver disease. That's a lot of people. That's a lot of people. 70 to 100 million have this, and 10 to 25% of these will go on to develop cirrhosis or steatohepatitis. That's just this gone a little further. So you get fatty liver first, and if it gets bad enough and you add in a little bit of inflammation, and we'll talk about how that happens, then you're going to go on to develop steatohepatitis and cirrhosis and all of the problems. Now, one of the reasons I got interested in this is I'm seeing so much of it in my practice. Just this past week, I had a 35-year-old gentleman that I've known since he was a teenager. He became a patient of mine as a teenager. He came into my office. He had gained a little bit of weight. His liver enzymes are up. We got an ultrasound of his liver. He's got fatty liver disease at 35. And I know that if he doesn't change his diet, he is going to progress to hepatitis and then cirrhosis. The same kind of cirrhosis that an alcoholic gets. If you just look at the liver, don't take any history, just look at the liver under the microscope, you cannot tell the difference between alcoholic hepatitis and non-alcoholic steatohepatitis. They look the same under the microscope. They're just different causes. Same end problem, different causes. So whether it's alcoholic hepatitis and cirrhosis from alcoholism, or whether it's just fatty liver that progressed, it's the same thing in the end. And you've all known alcoholics that had cirrhosis, right? And you know what happens to them. Their belly swells, and they get fluid, and in the end stages, their legs weep with fluid, their belly weeps with fluid, they start bleeding internally, and they're at high risk for cancer of the liver, and the same happens with this. I have another patient right now, fatty liver disease, went on to non-alcoholic steatohepatitis, and he is dying of liver cancer right now. So this is a serious problem. It's not to be trifled with. And it's very closely associated with other things that we've talked about. Diabetes type 2. Almost everyone, not everyone, but almost everyone that has diabetes type 2 and is overweight has some degree of fatty liver. Metabolic syndrome, which is tied in with this. Same thing, closely related to fatty liver. Insulin resistance is a part of all of these, and it's a part of fatty liver disease as well. because the same thing that causes fatty liver disease causes insulin resistance just by fatty infiltration of the pancreas. Often when you lay down fat in the liver and get fatty liver disease, you are simultaneously laying down fat in the pancreas and causing or raising your risk for diabetes type 2. So that we need to understand really well. So non-alcoholic fatty liver disease is simply excess fat in the form of triglycerides that is deposited in liver cells. That's all it is. When you look at it under a microscope, you take a slice of liver and you look at it, what you see is a lot of fat, way more than should be, inside cells in the liver. And that's, when we see that, we say, oh, they have fatty liver disease. Then the only question we have to ask is, are they drinking excessive alcohol? Then we say, oh, that's alcoholic fatty liver disease. And if they're not, then it's non-alcoholic fatty liver disease. Same picture under the microscope, two different causes, but they're really one cause, as you'll see. So, what are the risk factors for going from fatty liver disease on to non-alcoholic steatohepatitis? Steato just means fatty. That's all it is. It's just Latin for fat. So what are the risk factors from going from having a fatty liver to trouble, to steatohepatitis, or to fatty liver plus inflammation? And I have them listed there. The older you are, the more likely that you'll develop the non-alcoholic steatohepatitis. That's fatty liver plus inflammation. If you have diabetes, that also increases your risk. If you have elevated liver enzymes, that increases your risk. And the higher they are, the higher the risk goes. If you have a body mass index of 28 or more, that increases your risk. If you have higher visceral adiposity, that's just weight around here, right around the middle. You know the apple shape versus the pear shape? If you have an apple shape, that's fat around the middle. And when you have fat around the middle here on the outside, you've got fat around the middle inside. That's the visceral adiposity. So all of those are risk factors to move you from fatty liver, and fatty liver doesn't really kill people. It's NASH that is the killer. So the health risk of having steatohepatitis are cirrhosis, liver failure, and liver cancer, and people with either of those, either the fatty liver or the hepatitis, are both at increased risk for death from coronary disease. So this is not just something, oh well, I've got fatty liver disease, big deal. This is, I've got fatty liver disease, and that puts me at higher risk for going on to something really serious, and also for having heart problems. So very, very important. Now it's interesting that like diabetes type 2, some people don't get it till they're very heavy, and others get it if they're just a little overweight when they're carrying their weight in the middle. And that's genetic. So in some people, even if they're not way overweight, this 35-year-old that was in my office, he was about 6 feet and he weighed 215. Well, that's overweight. He should be, down around 175. But it's not terribly overweight. You wouldn't call him grossly obese. But he already